Are you wondering if you're too young for joint replacement surgery? While most people who undergo knee or hip replacements are over 60, more adults in their 30s, 40s, and 50s are choosing these procedures to regain mobility and reduce pain. Age isn't the only factor doctors consider. The severity of your pain, your activity level, overall health, and the impact on your daily life all play a role in the decision. Common reasons for joint replacement in younger adults include osteoarthritis, injuries, rheumatoid arthritis, and other conditions like avascular necrosis or developmental dysplasia of the hip. Artificial joints typically last 15 to 20 years or more, especially with regular follow-ups and healthy lifestyle choices. New technologies like robotic-assisted surgery may also offer faster recovery. Don't let age alone keep you from seeking relief and improved mobility. If joint pain is limiting your life, talk to a doctor at CAO about whether joint replacement is right for you.